So I thought, seeing as though it is a year today since my very last chemo, that I would do a video. Someone that I know has been diagnosed at the age of 29 with breast cancer, and I've been talking to her a lot, and I know that she's going to be going through chemo soon, and I started thinking about a list of sort of things that helped me with chemo, and then it occurred to me that I hadn't actually really done a video about it, because there are some things that I found really helped. My cat just loves to be in my videos. Hello. So I thought I would do a quick video about my 5 top tips for getting through chemo. And they're little things that you can try. They're tips that I picked up mostly from my chemo nurses and my mum, because my dear mum had breast cancer 6 years before I did. So things that you might want to try if you're going through chemo. So my story is, I was diagnosed at the age of 34 with triple negative breast cancer. I completed 6 rounds of chemo, which I finished a year ago today. My chemo treatment was FEC-T, so I did 3 treatments of FEC, which is a 3-drug combination, which is 5-FU, epirubicin, and cyclophosphamine. I think that's right. So I had those first, and then followed up by 3 rounds of docetaxel. Both of my chemo regimens were quite different in their side effects. So it is used mainly for breast cancer treatment. Side effects include hair loss. I had mouth ulcers, vomiting, nausea, diarrhea, constipation. So that was with the FEC mostly. Docetaxel was slightly different. It was very much based around bone pain, joint pain, inability to move, stiffness, some nausea, stomachache, heartburn, hair loss. So depending on which chemo you're on, you might be facing different side effects. You might be having some side effects, you might be having no side effects, you might be having lots of side effects, and it really depends on you, your health before chemo, just how you react to drugs in general. But I was very aware that putting the amount of drugs into my system as I was putting in, I didn't really want to overload it too much with a lot of the drugs that they give to counteract the side effects. So when you go through chemo, they will give you a huge amount of drugs. I had cyclizine for sickness, I had some heartburn medications, they gave me medications for joint pain, so I think gabapentin, which I use for my nerve pain when I was taking my docetaxel. So I was already overloading my system with a lot of different drugs. So these are my 5 tips for trying to counteract and trying to get through chemo the best you can without putting any drugs in your systems. So top tip number 1, water. So there's 2 reasons for drinking the water. For me, if you followed any of my videos, you'll know that I have very low blood pressure, which is good most of the time, but I have low blood pressure and bad circulation, which means that things like taking bloods, getting IVs into my veins can be very difficult for the nurses, and I've heard this from many a nurse. What I did before my chemos was I made sure that on the morning of my chemo that I drank at least 1 litre, if not 1.5 litres or 2 litres of water before my chemo appointment. Now what this does is it plumps up your veins, so it makes finding your veins a lot easier if you're hydrated. So that was the main thing. Also keeping your hands warm when you go to get your chemo. So I had chemo during the winter. So the colder your hands are, the more your veins constrict and the harder they are to find. So quite often when I went into the chemo ward, they would get a hot hand warmer thing, and they would put that over my hand to start with. So I'd have that on for about 20 minutes, so that it made finding the veins a lot easier. So that was good. So that helped a lot. Also, once you've had your chemo, the more water you drink in the hours after your chemo, the faster the chemo drugs are going to work back out of your system. So they should only stay in your system for about 48 hours. But that will be sped up by the amount of water. So the water will filter your blood a lot faster. And it was my chemo nurse that told me, the more water you drink, the better you're going to feel faster. So the side effects shouldn't last so long. So I just used to have a water bottle that I carried around with me all the time. I made sure that I drank water on the hour, every hour. And I did that for the whole week after chemo. I was drinking sort of 3 to 4 litres a day, which means that you're going to need the toilet all the time. But I didn't fare too badly with my side effects, so I think that was probably part of the reason why. Tip number 2 is fresh pineapple. One of the side effects that I was warned about with my chemo was mouth ulcers, and I think that is quite a common side effect with a lot of chemos. And of course, once you've got mouth ulcers, it's very difficult to eat, which means then you're more likely to lose weight. It's just very bad for you to lose weight during your chemo treatment. They're constantly weighing me, and I think they were quite pleased. I wasn't quite pleased, but they were quite pleased that I was putting on weight. But I ate a lot of fresh pineapple. Now, fresh pineapple has an enzyme in it called bromelain, something like that. And apparently that is very good for the mucous membranes in your mouth. So I would eat this all the time. I used to take a box in with some fresh pineapple, and I would eat it during chemo. And I was very lucky. I only had 1 or 2 mouth ulcers, and they weren't even that bad. But I have known people that had 6, 7, 10 mouth ulcers in their mouth, and then they cannot eat anything apart from soups and pureed things. So take care of your mouth during chemo, very important. The other thing that I would say with mouth care is I swapped my toothbrush to a baby's toothbrush, so very, very soft toothbrush, because what you don't want is you don't want any cuts in your mouth. So when you're on chemo, your immune system is close to 0. So you've got no neutrophils, no white blood cells, nothing to fight infection. So the last thing that you want is to get a cut in your mouth and get bacteria into that cut, because it's very hard to treat. So I use baby toothbrushes, and I would change my toothbrush at the end of every chemo cycle. So I had six toothbrushes in the space of my 6 chemos. So that's quite important. Okay, tip number 3 is apple cider vinegar. And it was my mum that sort of read up on this. And initially she said that I should try and drink a teaspoon of it in a glass of water every morning. Now, I tried this and it made me retch, so I didn't carry on. But it is supposed to be very good. If you can stand it, it's supposed to be very, very good for your digestive system and keeping all your pH levels throughout your digestive system quite level, which will then knock on with your nausea, your vomiting, your diarrhea, constipation problems that you might be having. What I did use it for, however, and this is a strange one, I used to put a cup of it in my bath water, and I used to have a bath every night. So when you're on chemo, you can be very prone to infections because you've got no immune system. So that can include things like skin infections, and for all you girls out there, things like thrush that can make chemo really nasty, I'm not going to lie. And I knew that I was prone to that because every time I take antibiotics it throws my whole system out of whack, so I was very keen to not have to deal with thrush. So apple cider vinegar baths helped to keep the pH level around your body very level, and I was very lucky. I didn't have any skin infections and I didn't get any thrush, which is fab. And I put that down to these baths. So I would just put a cup of it in my bath water, lie in the bath. It wasn't enough cider vinegar to smell like you're sort of getting out of a fish and chip shop, but it was enough just to keep those things at bay. So I was very happy about that. Also, make sure that you moisturize your whole body all the time. Again, you don't want, same as your mouth, you don't want dry, cracked skin, because if you get cracks in your skin, it leaves open wounds, which means that infection can get in, and which means that your immune system is not going to work hard enough to fight those. So it's quite risky for you to get things like cuts and grazes and that sort of thing. So make sure you moisturize. Tip number 4 is coconut water. So this is very important for boosting your neutrophil count, your white blood count. So I went in for my last chemo to get my bloods done. So I used to have to get my bloods done 48 hours before my chemo, which gave them a chance to check on my levels, gave them a chance to check my white blood cells, my liver enzymes, my everything. So I'd gone in 48 hours beforehand, I had my bloods done as per usual, and the hospital phoned and said, your neutrophil count is too low, we think we might need to cancel your chemo, which of course was kind of devastating because I just wanted to get it over and done with. So they said, well, come in on the morning of your chemo, but make sure that you drink lots of coconut water. So this is my chemo nurse that said this to me on the phone. That was a bit strange. So my neutrophil count was supposed to be over 1 to get my chemo, and they'd measured it 48 hours before my chemo at 0.5, which is ridiculously low. I should have been hospitalised, but they didn't. So I drank, I think, 2 litres of coconut water, had my bloods done before my chemo. So bear in mind, this was only 48 hours between them, and my neutrophil level had gone up from 0.5 to 6.1. Now, I was a bit dubious about this. I wasn't sure if they got kind of some of their numbers mixed up, and actually it was 1.6. But either way, it had to be over 1, and it had risen massively. So my chemo nurse swears by it. In fact, my oncologist mentioned it in one of my last appointments after I finished that chemo, and he said that he recommends coconut water. So that's something to bear in mind, especially when you're coming up in the last few days before your chemo, because your levels, your blood levels, need to be right and they need to be up, otherwise they won't do your chemo. And there's nothing more frustrating than going in to get your chemo and having it put off for a week. Because I had my 3rd chemo was put off for 2 weeks because my liver enzymes were out of whack. Tip number 5 is peppermint and ginger. So for my first 3 chemos, for my FEC chemo regimen, a lot of the side effects were sickness, vomiting, just feeling generally sick, having that kind of awful, I feel just gross, diarrhea, constipation, that kind of thing. Ginger and peppermint are known to kind of ease any of those symptoms and to kind of rectify nausea. So I ate a lot of ginger things, so I would drink a lot of ginger ale, I drank a lot of peppermint tea, I ate a lot of mints, I would use ginger and mint in my cooking if I could, and all of that really helped me to feel a lot less sick, and it was probably more effective than some of the anti-sickness drugs that they gave me. So they would give me, I had cyclazine as my anti-sickness drug, which was fantastic, but it used to knock me out. So I would end up taking it in the morning and then sleeping for the whole day, and then I'd have to take another one just to get to sleep at night. So I wanted to move away from that, and it just makes you feel groggy and out of it and drugged up, and I didn't like feeling like that. So peppermint, ginger, worth giving a try. So those are my 5 tips. I hope that at least one of them will help you get through your chemo, for those of you going through it. I hope it's going well, and just know that it might feel like it's forever right now, but you'll wake up one day and it'll all be over. I'm a year down the line. I still can't believe I'm a year down the line, but I am. It feels like a distant bad dream. So yeah, so best of luck with your chemo, and I hope to do another video soon. I don't know what about. I'm running out of bad things to video really. So if you have liked this video, please subscribe to my channel. If you have any suggestions for videos that you would like me to do, then please just pop them in the comments below and like and subscribe. Okay, see you soon, bye.